I'm now pleased to introduce Jassen Strokosch. Jassen is a senior member of the executive team at the Illinois Department of Children and Family Services and serves as the chief of staff for the agency. Prior to joining IDCFS, Jassen spent nearly a decade at Children's Home and Aid, a leading child and family service agency in Illinois. For nearly 3 decades, Jassen has significant experience in the private sector, where he served in leadership roles in public affairs, public policy, and crisis communications. He has worked on issues ranging from access to higher education, labor relations, prescription drug medicine affordability, gun violence, broadband availability in underserved communities, high-speed rail, and access to sexual and reproductive health care. Jassen received his BA in political science from Drake University. It's now my pleasure to welcome Jassen to our meeting.
Thank you, Pastor, for that introduction, and thanks, everybody. We do a lot of public-facing presentations as DCFS, and rarely, though, to a group of individuals who are looking for ways to get involved and advocate on behalf of child welfare and human services. And so it's a slightly different audience than we normally present to, but I love it because it's exactly what we need. And folks out there carrying the message of what will move this work forward and help us all do better for the children and families that we serve. So one of the things I wanted to talk about, the sort of 2 areas I was going to talk about, was a little bit of what our priorities have been as we enter our 3rd year here with this leadership team and with this administration, what our priorities have been and where they're headed. One thing I wanted to call out, because I think I want to make sure that the folks in leadership and then the folks that are here informationally on this call, on the Zoom here, is, one of the things that's been consistent. I've had the privilege of being part of this administration since day one, both the governor's staff, but also the leadership team that's been at DCFS. And one of our earliest commitments has been to restore the role of DCFS to see itself and make sure that the rest of the child welfare system sees us as partners in this work. DCFS is incredibly central to this system. We drive a lot of the financial support and the budget and a lot of the decision making. We are a conduit for a lot of things that are done from the legislative and executive branch side. And we drive a lot of this, but we are just that. We are central to it, but we never do this work alone. So much of what we do involves other systems and other agencies and organizations, and understanding that that's not a dictation, but a partnership was one of the very first things that Director Smith made a commitment to when he started back in 2019, and we've tried to carry that through. So I want to make sure in platforms like this, where we have everyone ranging from ICOI to our General Assembly to Mike and Mark and to folks who clearly are deeply committed to the work of human services, understand that's the perspective of this entire leadership team when we come forward. So I just wanted to start off with that. Pastor, can you move me to the next one, or whoever's controlling the deck? I'm sorry if I assumed drawing there. I wanted to, we just recently, actually this week, I believe, posted a strategic plan that a lot of folks have been very helpful in pulling together from the private sector. We've literally included input from about 1,400 different individuals from different sectors in that strategic plan. But rather than sit here and walk through that, which has 11 sort of big bucket areas, I wanted to really give a chance to highlight 3 specific areas where we've really had a lot of investment over the last 2 or 3 years, and then I'll touch briefly on the budget, which I think you'll see reflects that commitment continues and will continue in the years ahead. One is the strengthening of the child welfare workforce across the board, DCFS and the private sector side. We are keenly aware that building a stable, diverse, and highly professional and qualified workforce is a key priority for us. It is a challenge. It was a challenge coming into 2019, and it is more of a challenge now than it's ever been before. There is, between what's gone on in the larger workplace nationally, and not even in child welfare, but just in every industry across the field, finding a qualified workforce is incredibly difficult no matter where you work these days. And we recognize this as probably the single biggest challenge to effectively making any change within child welfare and frankly in human services is going to be having enough qualified individuals to carry out that work in order to execute on any vision that we put forward. So it's been a priority the last few years. We've done a lot of work in partnership with the private sector. There's a lot of folks on this Zoom who have participated in our child workforce task force meetings. We've had some great recommendations out of that, a lot of collaboration with the General Assembly and others, and in fact, really put together some significant changes for how the department works to support that on all ends, from the qualifying of what it means to be qualified to work in child welfare, to increased salaries for the individuals doing that work, to some incentives and scholarships on the scholarship end for out of college to get people to want to come into this workplace in the first place, and then to retain those staff when they do get here. So there's a deep commitment there that we'll touch on in the budget piece quickly. The other big priority for us has been a reinvestment back in communities. So much of what makes families successful and children successful is they need access to the services locally in their systems where they are. Whether it's domestic violence or substance abuse, if they're having to go 150 miles away to get access to what they need, we know that directly impacts whether they're going to be successful in those services. And ultimately, the children and families we serve and the private sector serves every day, developing those community resources is going to be key to long-term success. And that's complicated. DCFS is typically a consumer of those services, and there's other agencies like HFS and DHS. I'm sure Representative Harris touched on some of that with some of the earlier presentations, who have much bigger budgets and often drive what happens statewide on that front. But DCFS is doing what we can with our budget to develop those back out locally in the community where our families and kids need them. And then lastly is organizational resources. One of the things that has always been a struggle with DCFS, particularly with the amount of turnover there is at the leadership level, is really fundamentally infrastructural organizational resource pieces tend to get pushed and not executed on. And when I talk about that, I talk about things like finally executing on things like family first, putting a good solid plan together with the feds on that push us towards front end and prevention work. Things like putting youth care in place so that our children and our caregivers have a managed care program to help them access medical and mental health services, something that sat for 4 or 5 years not getting done, and then we're now about to come up on the 2nd year anniversary of that, something that's been tremendous for our caregivers. We're also launching 2 huge initiatives that just started in the last month or so, which is a complete replacement of our child welfare IT infrastructure with what you'll hear called CWIS, with this child welfare information system replacement that will affect all of our partners in the private sector side, but also internally at DCFS. That's been in the works for many, many years. And we spent about the last year and a half executing the RFP side of that and getting that done. But in fact, last 2 weeks, we've had the contractors that are going to put that in place in the offices, literally starting to develop that piece. We're super excited about that project. And then the other piece I want to mention here is a recent announcement around moving forward with what's called the SAFE model. This is something that comes from a group called Action for Child Protection, which is a group that has an evidence-based system for making decisions throughout the entire process of the child welfare system. We used to have something called the CRAP, which was used to assess for safety, that has been in place since the early 90s. It's very dated. This would replace not only the CRAP, but put tools in place at every single step of decision-making within child welfare that gives us an evidence-based model for how we make those decisions, from returning home to when things are safe, to court intervention and things like that. And so we're incredibly excited about that as well. And launching that again is another big sort of infrastructural support that all of those things will be with us for decades to come in the child welfare system, and are long overdue and needed in order to drive this work forward better. So we're really excited about some of the movement that's happened around that. I know I'll just mention one last thing on the SAFE model side is one of the things that we've started on in the very, very short term right now, the very first group we've gotten together on this is a work group around legislative changes that are going to be necessary for that system to come in place, be effective, and work. And so there is a great deal of legislation over the next year that's going to need to change in order to support that new model. We're on the very front end of that, but as I talk to a group of folks that are interested in being that are our advocates, people who get out there and talk to our General Assembly and other elected officials to help us move that work forward, there is a great deal of work that's going to be needed there. Casey Foundation has a new policy director that's dedicated just to Illinois that's helping work with us on that, as well as some other partners. So we can put together a package of what that looks like in terms of what will need to be advocated for. So in the months ahead, look for lots of opportunities to get involved and advocate on behalf of putting that system change in place. So Pastor, we can jump to the next one if you want. I'll try and move through these quickly. I want to be very cognizant of time for folks here, so I apologize. I wanted to touch briefly on the budget, mainly because I think we can talk a good game all the time about what our commitment is, but as a government agency, where the rubber meets the road in terms of our commitment is what we put into dollars and where that money gets spent. That is our real commitment to support. So I wanted to just include in here a couple quick highlights from the upcoming year's budget, and then looking at what that's looked like over the last few years. You can see we've gone in one direction. That one direction is growth and larger investment. And I put a couple of highlights in here, but a giant part of this budget is going directly back and supporting the organizations that put on today, for example's event, but that make up the backbone of the child welfare system in Illinois. It's our private sector partners. And one of the things that I was struck by looking back at a little bit of the history on Lutheran Day is the original Lutheran Day was greatly about holding accountable the state government for needing to do a better job of investing in child welfare and human services here. And, you know, LSSI being one of the leaders in that effort and really trying to push for, you know, having done this work for a long time, where is that investment? And Lutheran Child and Family Services, sorry, I don't want to cut anyone's standing there. And so what I was struck by was that one of the things that we've done over the last 3 years is try to address that exact issue that was happening back in the early 2000s, which was where is this commitment from the state to invest in the system? And so one of the things I'm really proud of is if you run the numbers on what DCFS has invested back in our private agency partners over the last 3 years, it almost exactly equals what would happen if over the last 20 years, we had continued our commitment to giving cost of living increases every single year, which is how this was always intended to be. If you actually rolled those cost of livings over the last 20 years, had the state met its commitment through every governor, through every General Assembly, through every director, we'd be where we are right now. So I like to think of that as over the last 3 years, we just made up for 20 years of disinvestment. We made up for it in 3 years with this General Assembly and this director and this governor. And so I'm incredibly proud of that. And some of that reflects on the screen right here, which is you can see that budget side. So Pastor, you want to jump to the next one and I'll touch briefly. This just reflects laid out. You can see what this budget looks like laid out. You see this increase year over year. You see this sizable reinvestment with our new governor and with this director that's been consistent through. So it's sometimes nice to just see it in a graph form and understand that it's just a really, I think, an incredible commitment by this governor and the General Assembly, both of which I would be disservice not to give them the amount of credit and involvement they have in DCFS and have really pressed us to find ways to, if they find the money, can we find ways to improve the system? And that's been a very great relationship back and forth. This side I wanted to make sure everyone on here saw, because this is when I talk about, you know, we can talk a good game, but what does it actually look like in practice? This shows since 2019, the dramatic increase in investment in our private sector partnerships. This is institutional groups, homes, transitional living, intact services, foster care. This is all increased investment in the private sector side that we've made since 2019. And again, as I mentioned, not to beat a dead horse, but this numbers look this way because we had a lot of time to make up for. We had about 20 years without enough investment. And so this was a chance to catch up with that greatly on those organizations. One of the things I'm most proud of in this is it's not just money being pushed back into the system. A lot of that money is very specifically tied to increasing and making competitive salaries on the private sector side, so those staff are getting paid enough to both want to do the work, but also retain and stay and do the work. We also made a real commitment to trying to make those positions be able to be competitive with what we offer in the public sector. So our folks on this call that have already been involved in this work know that those budgets now are not tied to potential COLAs or what might be COLAs, but we've tied those salary numbers directly to what gets paid to our public sector union workers. So we've now pegged those to a percentage. And so as those increase, our investment in the private sector and those salaries will increase. And so it does two things. One, it gives a commitment to the private sector workers that this isn't a one and done sort of bump. We're going to continue to track that increase and give you a competitive wage through the organizations you work for. But also it allows leadership like Mike and Mark to know what's coming down the road. They're not guessing. They're not making decisions in May and June about the next fiscal year. They know, okay, this is the increase that the union's going to see. We know what that's going to look like for us. And that projection for them and their board members is incredibly helpful. And we think is a really important part of bringing stability to the system. And then this just breaks it out a little bit more, but we wanted to show a little bit of where this went back to in salaries, as I mentioned. So this ties, we're already tied at the 80% level to AFSCME starting salary, and we've made a commitment to get into the 90% level. 25 million of this is also set aside for capital improvements in FY23. One of the things we talk a lot about is the workforce needing a reinvestment. Some of our infrastructure out there needs some reinvestment as well, particularly on the residential and other sides. There's some buildings that folks on the private sector side just haven't had the money to invest in. We've been partnering with a lot of different organizations, from building out brand new programs, or to reinvesting and updating and modernizing some of the existing infrastructure that they already have. And we're committed to doing that for FY23. And we're hopeful that that 25 million investment will continue in the years ahead. So we've already worked with some providers that have, we got about a dozen projects or so working on with them, but we look forward to more and more ideas coming out over FY23 and 24, so we can rebuild some of that actual brick and mortar infrastructure out there that's so vital to our kids and families. So those are the main pieces I wanted to touch on there in this, and give a quick high level overview. I know I covered a lot there and I talked fast. I was trying to be cognizant of time given everything that transpired, and I love Q&A. So I don't know how many people are out there still and available, but Pastor, I hear you're the moderator on this. So if you've got some questions that have come in, I'm happy to answer those, or chit chat or have conversation, whatever will serve folks best that are left on here.
Would you say a little bit more about DCFS's role with community-based partners like LSSI and LCFS?
Sure. So there's parts of DCFS that are the sort of front end part of this system that's really the work that we do almost exclusively. So things like operating the hotline where abuse and neglect calls come in. And then if those reports equal an investigation and we send someone out to knock on the door and say, look, is there evidence of abuse and neglect? Those pieces are owned entirely by DCFS. Virtually every other part of our system, with some little exceptions like there's a few other things, but in general, every other part of our system is done at least in part in partnership with our providers. So for example, Lutheran Child and Family Services and LSSI, are representative of some of the many organizations across the state that do things like what we call permanency or foster care, intact family services, which is prevention work where we have kids where we keep them in the home with their parents, but they have some sort of crisis that brought them to our attention and they need services. And another hugely growing area which is called child welfare services referrals. And that's where we get a call to the hotline and it might not quite meet the criteria for investigation, but the fact that someone's calling means there's probably some help that family can get. And we send out a social worker for an intervention to say, hey, what's going on here? Can we help you out? What are some services you might need? All of those things are done disproportionately by agencies like LSSI and Lutheran Child and Family Services. Those are done. That number's varied a little bit. It's somewhere right now at around the 79%, 80% level. Sometimes it's as high as 85 or 86% of that work is actually done in the private sector. So we contract with them. We set sort of what those program plans look like, how that work needs to be done. We do a lot of the training for the staff that conduct that work. We do a lot of the licensing to approve them to do that work. So we work in partnership on that front. But it's really done on the private sector side. And, you know, as someone who spent about a decade in the private sector side before this, in an organization with a lot of similar backgrounds here, not Lutheran, but other backgrounds that have done this work for a long time. You know, some of the things that, you know, the work that we now call child welfare and we think of as child welfare, it's been going on for a lot longer than there's ever been a DCFS. And so organizations like this have represented a commitment from the community to protect children and give them better futures. That commitment predates way before, you know, what we think of as state government and DCFS. And so many of the organizations that are doing this work every day are exactly those organizations with 100 plus, 120, 130 year histories of serving children and serving families and doing what we now call child welfare. So there's a little bit of a transition of where some of that funding comes from. We're probably offsetting what normally would have been done a lot more with donors and other areas are now happening with state grants. But from the standpoint of having a mission and a vision for having kids be safe and strong and supported in loving homes, that commitment predates long before anyone even thought of calling something DCFS and before we even had juvenile court. And so this is really I mean, I'm honored that what we've essentially done has been able to fund agencies that have had this mission long before any of us were here doing this work. And so that really gives us a chance to continue to fund that. And I'm incredibly proud of that. Of in Illinois, particularly, where we have a very long tradition of private agencies stepping up and doing the bulk of that work.
Thank you. I got one more question. Sorry. What outcomes do you measure to see if the increase in budget is actually making a difference in results?
That is a fantastic question. We're looking at it in a number of different ways, and I'll just say this. One thing we don't lack at DCFS is the number of people that hold us accountable and have oversight. So we have a great many of, just before I got on this call, for example, was doing some phone calls with the ACLU around some of the things that we have under consent decree and other places. And so we have, and the federal government holds us to a bunch of different standards. So we have, I could list probably 30 or 40 different measures that we look at, but at a high level, it's things like timeliness to permanency, you know, how long, and meaning how long does it take for a youth to achieve, if we bring them into care, how long does it take before that youth is in a permanent setting? Might be a return home, it might be adoption, it might be living with a guardian permanently, but achieving permanency, things like that. Maltreatment. So how maltreatment in care, is there another incident of abuse or neglect that took place after the kid came in, after a youth came into care? Looking at reducing numbers like that. We also have a number of other things we're looking at. I know earlier you guys had some conversation about blind removal. One of the things that we have put forward is one of the most aggressive plan to address disproportionality in the system that I think any administration's put forward. We've got a new position of someone who's literally dedicated to just looking at the role of race in the child welfare system. Dejanay Brown, she's fantastic in that role, has really put together a great strategic plan which looks at that. So there's a whole host of different numbers on that front that we look at, including hiring and retention numbers. We get reports back from all of our private sector partners on their staffing levels, and that's something we look at all the time as well. So a huge range of those that we look at, and we will adjust if need be on all of those.